We're here with Eric Brown with IBM Watson for healthcare big data analytics. Eric, what are some of the first ways that people are going to be impacted by the powerful big data analytics that IBM Watson can provide?
Well, certainly in the healthcare space, these analytics are going to help providers take advantage of all of the information that is available, which is it's just so hard for them to incorporate into their decision-making process. And so, as a specific example, as a physician, I have a history of experience where I've treated a large number of patients, but there's still millions of other patients out there that may have been treated for the same problem. Big data analytics allows us to take advantage of looking at all of those patients, the millions of patients out there, and extracting insights that can help the physician make better decisions.
And this is a follow-up question. Is there a time frame that you see that impacting people, or is it already happening?
I think it's already happening now, and over the next 5 years, you're going to see more and more of these capabilities roll out.
So we're at Mount Sinai Medical Center today, and visiting today with Dr. Stark, and who is a physician and also an expert on innovation. So as you think about the clinic of the future, what do you see as most important of the major changes that we should be looking for?
Yeah, so first off, I'll say thanks. Yeah, thanks for having me. When I think of the clinic of the future, and people ask what is the clinic of the future, I have to say I don't know. That's what we're here to find out. And importantly, figuring that out involves the patients. We have to include the patient in the design process, and that's what we aim to do here. The clinic of the future is probably not brick and mortar. It's probably virtual. We all walk around with one of these in our pockets, and there's an awful lot you can tell from just looking at somebody's mobile phone data. So I think the clinic of the future is out where you live, it's where you work, it's in the community, and it's continuous rather than episodic visits when you have a problem.
So how will it affect the physician's practice in general?
So, people talk about the physicians being overwhelmed with lots of data, and as a physician, I certainly have had that problem, patients coming in with stacks of data, but I actually see this as potentially liberating, because it lets physicians get back to doing what they want to do, which is having a human interaction with their patient, giving guidance, and importantly, it shouldn't be the physician who's necessarily analyzing all that data, and I think we need to redesign not just how the data gets collected and analyzed and used, but who should be collecting the data and who should be looking at the analysis. So it really involves a much broader process redesign than simply the technology and the tools.
Yes. Well, thank you for visiting with us today. We really appreciate sharing your insights.
Great to talk to you. Thank you.